Welcome to Baptist Medical News Network. I'm Rhonda McRae. Thank you for joining us today. And today we're talking about joint replacement. And here to help us, we have the Medical Director of Baptist Joint Replacement Center, Dr. Brian Johnson. Thank you for joining us today.
You're welcome. Thank you for asking me.
Thank you. Well, first question, just right off the bat and talking about joint replacement, what would you say are sort of the key considerations a person who is considering having joint, what would those be? What does a person who's thinking about it need to think about?
When I talk to my patients about consideration for joint replacement surgery, I tell them they have to look at it in two ways. The first way to look at it is that it's a resurfacing procedure where they've worn away the bearing surface of their hip or knee, and by doing an artificial knee joint, it gives them a new bearing surface. By giving them a new bearing surface, it takes away the pain. The other way I tell them they have to look at it, and in my estimation, the more important way to look at it, is that it's a quality of life procedure. If the pain in their knee or hip gets to the point where the non-operative things aren't working, they're hurting all the time, they find themselves in a foul and grumpy mood, or if they find that they can't go out or don't want to go out because their hip or knee are holding them back, well then their life starts becoming more of an existence and less of a life, and it's time to fix their hip or knee.
That's major, and everyone knows, I guess, when they've kind of reached that point. Well, then go ahead at Baptist, talk about the kinds of joint replacement surgeries that we offer.
We offer a full spectrum of joint replacement surgery. We offer total hips, total knees, we do unicompartmental knee replacements, we do hip resurfacing, we do total shoulders for people who have arthritis in their upper extremities. We do computer navigation for all of our hips and knees. And we offer the latest in techniques as far as approaches, subvastus approaches for knees, limited posterior approaches on the hips. We even do anterior approaches on the hips with a specialized table. And we offer a full gamut of services and the most up-to-date technology and techniques that are available.
Well, thinking about that, you've kind of talked about we have the technology, but at our Joint Replacement Center, what would you say our philosophy is for care and recovery for our patients?
Our philosophy on care and recovery is we think that this whole process starts from the day that you book them from surgery. So our care plan starts there, and it goes to, we have a very comprehensive joint class that all of our patients go to, because the more informed that the patient can be preoperatively, the less worry there is at the time of surgery, because the more you know going into it, the more at ease you are. I think our philosophy is that on the floor, we want them to feel as though they're at some boutique hotel and not a hospital. Right? And within that same regard, we want them to have the feeling that this is a process of wellness, not a process of being sick. So, and we want them at the end of their stay, at the end of their care, and when I say the end of their care, it isn't just when they leave the hospital, because this continues on in their rehab and their follow-up visits. But after it's all said and done, we want them to tell us that they had a great experience. We want them to say that if they have another joint, this is where they want to come, and we want them to be able to come to us and say, I am going to recommend the Baptist Joint Center to all of my friends.
And so that kind of leads into my second question, and you may have already answered it, but what would you say that our goal is for our staff as they deal with our patients?
Our goal for our staff, we just recently had our kickoff event for the Joint Center, and what I had mentioned to them was that everybody is part of the process. Everybody from housekeeping to nursing, to administration, to the doctors, to the physical therapists, they all are integrated into this process. And it's the old philosophy that a chain is only as strong as its weakest link. So if we fall down in any of those areas, the room doesn't get cleaned, somebody's pillow doesn't get fluffed, they have to wait to get their medicine, they sit too long in PT, the surgeon doesn't come and see them. If any of those things break down, then it doesn't matter how good the rest of it was. So I think our philosophy is that we're all in this together to make it work, and we need everybody's participation.
Well, then, let me just conclude then. Why Baptist? What makes our Joint Replacement Center unique?
I think what makes our joint center unique, and I have to go back to, this has kind of been a dream and a goal of mine for the last almost 20 years now. I started out training in USC with Larry Dorr, who's been former head of the Hip Society, Knee Society, and he put together his first arthritis center when I was out there. And my goal was to emulate that and make that better. And over the last 16 years or so, it's been a slow process of doing that. But here recently, with the partnership with Baptist and the assistance of Marshall Steele, although we were doing a lot of good things, it was helping us all put it together to make the complete package. And I think that's what makes the Baptist Joint Center unique. It's a complete package. It's a complete package from the beginning of care to the end of care.
Well, thank you so much, Dr. Johnson, for coming today, and thank you for joining us for our webcast. If you have any questions about the Joint Replacement Center at Baptist, you can call our Baptist Health Line at 1-800-948-6262 or 601-948-6262, and they'll be glad to help you with any questions that you may have about our programs, our services, and how to connect with the Joint Replacement Center at Baptist. Thank you for watching.